Hello, and thank you for joining us for today's webinar on polysubstance use with a particular focus on fentanyl and stimulants. My name is Dr. Andrew Holt, and I'm today's presenter, so let's get started. Aegis provides testing services for various healthcare specialties and provides insights into medication compliance, recent substance use, and drug interactions, whether those be intentional or unintentional. And Aegis has been offering testing services for over 30 years to many notable organizations. Today, we will discuss recent studies describing polysubstance use rates, the potentials, dangers of substance use and polysubstance use, and rates of fentanyl stimulant copositivity in Aegis tested samples. This graphic from the CDC is commonly referenced when discussing the rates of opioid overdoses, but it also shows a marked rise in stimulant overdoses after 2015, if you pay particular attention to that area on this graph. It's represented by the two blue lines. The stimulants are either cocaine, which is the light blue line, or drugs related to methamphetamine, which is the darker blue line. While they're not as rising as high as the synthetic opioids, other than methadone, which includes illicitly manufactured fentanyl, which is kind of the goldish orange lines, you will notice that after 2015, these two blue lines start sloping up at a higher rate. This figure is a combination bar line graph showing the total number of U.S. overdose deaths involving all stimulants from 1999 to 2021. So this is all stimulants. These deaths rose from 12,122 in 2015 to 53,495 by 2021. The dark blue line, it points out the number of deaths involving stimulants that are in combination with synthetic opioids other than methadone. And that, again, is primarily illicitly manufactured fentanyl. And the red line is stimulant-involved deaths without an opioid. So the number of deaths involving stimulants has increased steadily since 2014, whether or not opioids are involved, but a large percentage of these, as you see, involve synthetic opioids other than methadone. This is again from the CDC. This figure is a bar and line graph showing the total number of U.S. overdoses deaths involving stimulants primarily related to methamphetamine or methamphetamine-like stimulants. Again, the same time period is covered from 1999 to 2021. Drug overdose deaths involving these stimulants rose from 547 in 1999 to 23,837 in 2020, and a continued increase to 32,537 in 2021. Again, we'll focus on the blue line here in particular, which shows the number of deaths with stimulants in combination with opioids. And the red line, of course, are stimulants, these methamphetamine-like stimulants that do not involve opioids. So again, the number of deaths has increased steadily since 2014, whether or not opioids are involved. However, the majority, as you see, do involve synthetic opioids other than methadone. This is the same type of figure, but it's focused on cocaine. These deaths involving cocaine rose from 6,784 in 2015 to 15,883 in 2019. Then from 2019 to 2021, the deaths rose over 50%, up to 24,486 deaths. So again, focusing on the blue line, which involves those that involve stimulants or cocaine in this case, and opioids. And again, that's primarily illicitly manufactured fentanyl and those fentanyl analogs. The red line, again, are cocaine deaths cocaine involved deaths where no opioids are involved. But you will see since 2015, the number has increased significantly. And primarily that's because of the involvement of opioids. So again, focusing on polysubstance issues. So let's take a step back and discuss stimulants and depressant effects in general. So the two components of polysubstance use that we're talking about today. Stimulant misuse can have numerous effects, including rapid breathing, elevated temperature, nausea, vomiting, chest pain, and seizures and tremors. It can also increase the risk of heart attack and stroke, along with liver or brain damage. Then common stimulants, again, that we're including in here include drugs such as ecstasy, cocaine, amphetamines, and others. Depressants can also lead to organ damage, overdoses, and death, of course. Misuse of depressants can result in slowed breathing, passing out, a weak pulse, and altered mental status. And the common depressants we're talking about here, include opioids and benzodiazepines. However, there are others that do have depressant effects. Polysubstance exposures are extremely common without misuse. Intentional use, however, occurs when an individual wants to increase or decrease the effects of a substance, while again, unintentional exposure primarily happens when substances are cut into other drugs without the end user's knowledge. A 2019 study from the CDC showed that overdose deaths data, nearly half of all overdose deaths involved multiple substances. Of course, the dangers of mixing stimulants and depressants primarily are the masking of the effects of one or both drugs in the combination. So we've talked about the risks involved in both, the effects that both classes of substances can have. These can mask the effects of those. This can lead to unpredictable effects and individuals believing that they're not experiencing those common adverse events that we talked about, making it more likely to overdose. Just last week, a new report from the CDC showed that from 2011 to 2021, the rate of overdoses from cocaine and opioids increased more rapidly than the rate of cocaine-only overdoses. This is kind of illustrative of the slides that we looked at earlier. In 2021, the last year analyzed in this study, 78% of overdoses involving cocaine also included an opioid, with some geographic variance noted. The most notable change occurred between 2016 and 2017, when the rate of opioid stimulant combinations exceeded those without opioids for the first time. And that trend, of course, continues today, as we've seen earlier. The study also noted that 65% of overdoses involving stimulants similar to methamphetamine also included an overdose in 2021, again with some geographic variance noted. This is additional information from the CDC. They have an overdose website and just a different way of looking at the data. The largest percent of deaths involved opioids without stimulants, of course, which we've talked about earlier. However, there's 35% of deaths involved opioids and stimulants. So that was 2021. 2020 data on the previous slide. 2021 data shows 39%, almost 40% of deaths involved opioids and stimulants, with 42% of deaths opioids without stimulants. So when you lay these two on top of each other, just to kind of look at the difference, you will see that in 2021, a little bit larger percentage of the deaths involved opioids and stimulants, while the number of opioid-only overdose deaths decreased. So this may be illustrative of a trend. We'll see if the trend continues when we get 2022 data later on. We talked a lot about fatal overdose data. This is also from the CDC dashboard that they have, where they're talking about non-fatal overdose trends. They note in non-fatal overdoses with polysubstance exposures, opioids and stimulants are the most frequent combinations with any opioid and stimulant seen in 48% of cases, and fentanyl with any stimulant in 43% of cases. We focus a lot on opioids and benzodiazepines, but the rate of stimulants with opioids is at a higher rate than opioids and benzodiazepines and the two opioid combinations. And as we pointed out before, when considering the two most common stimulants, cocaine, fentanyl is observed in 20% of cases, and methamphetamine, fentanyl in 24% of these cases. These are three substance combinations. So when looking at these data, stimulants are involved in the most observed cases in combination with opioids and benzodiazepines. We'll spend a couple of minutes now talking about data from Aegis. Data from Aegis testing is most comparable to the previous non-fatal overdose data from the CDC, as our testing occurs primarily in the outpatient setting. We don't do any forensic postmortem testing at Aegis. We conducted an analysis of about a month worth of data looking at fentanyl positive samples where fentanyl was not expected. So these are cases where fentanyl was not indicated as prescribed. And in these samples, just above a third of the samples tested positive for cocaine along with the fentanyl. This is comparable to the CDC data from the non-fatal overdoses that showed this combination in 26% of samples. We also wanted to look at methamphetamine since it was focused on as well by the CDC. We found just right at 30% of samples, we detected methamphetamine with the fentanyl. This again is compared to about 24% in the CDC's non-fatal data. So our data showed very similar results to the CDC's non-fatal overdose data, a little bit higher rates of involvement. In addition to methamphetamine and cocaine, we also detected a small number of additional stimulants, including ecstasy, MDA as well. We did detect phentermine, methylphenidate, and a couple of novel psychoactive substance, cathinone class, pentalone and N,N-dimethylpentalone, which are closely related. Thank you for tuning into this webinar. We hope you found the information informative. I'd like to thank our fellow, Dr. Zachary Fricker and Dr. Joshua Schrecker for their help in gathering data and research for this topic. Be sure to look for future notifications for meetings in the future and join us as you're able to. We hope everyone has a great day. Thank you.